The lower the level of TSH when people are being monitored for this sluggish thyroid, the higher the probability that the individual will normalize with time. When the TSH was 10, there was about a 25% probability that they would normalize over time. And if their TSH was 5, there was a 75% probability that their TSH would normalize. I should also mention that this cohort, these individuals, were 65 years of age and older. As a general rule, there's a slight creeping upward of TSH as we age, which is normal. So if you were to see, let's say, a TSH of 8 in someone who was 25, that is more concerning than seeing an 8 in someone who is 65. So we do want to look at this gradual shifting upward of TSH as following an age gradient. But nevertheless, the reason why this study is so important is it adds to a body of evidence showing us that what one might call compassionate thyroid prescribing is problematic. Why? Well, like we mentioned before, that meta-analysis from the journal Thyroid that found 37.2% of people could successfully stop their thyroid hormone. A different study from 2024 found that half or a little over half of people on thyroid hormone were done so without meeting the criteria, meaning that they needed the medication. Now, why this matters, because the devil's advocate question is, well, what if the person has brain fog, has fatigue, has weight gain, and the hormone might be a method to improve those symptoms? I'm with you. Whatever we can do within reason to reduce someone's symptoms and suffering, I'm on board. But I'd like to quote for you a meta-analysis of 21 randomized control trials from the Journal of the American Medical Association regarding what happens when we give people with sluggish thyroid hormone, because this has been assessed. It's a fair question to assess, so researchers have assessed this. Quoting, among non-pregnant adults with subclinical hypothyroidism, the use of thyroid hormone therapy was not associated with improvements in general quality of life or thyroid-related symptoms. These findings do not support the routine use of thyroid hormone therapy in adults with subclinical hypothyroidism, or AKA sluggish thyroid. So again, why this matters is because if you're told that, well, your TSH is 5 or 6 or 7, let's put you on hormone because this is going to resolve your symptoms, that's very likely not to be the case. And instead, we want to focus on where the symptoms are coming from. Coming back to the point from a moment ago in terms of, well, if I am going to monitor my TSH to see if I go back to normal, which it does appear happens in the majority of people, what else can I do to ensure that my TSH will stay low or get back into the normal range? Selenium and myo-inositol are two great options. Selenium used at a dose of anywhere from 83 to 100 micrograms per day for about 6 months, combined with myo-inositol at 600 milligrams per day for 6 months, along with vitamin D3, anywhere from 1,000 to 8,000 IUs per day. And here is something I'm very excited about. A recent study added what I think was the most compelling data point, that red light therapy of your thyroid gland or applied to your neck can have a substantial impact. 2023 clinical trial, very interesting setup. They compared people who were given vitamin D and selenium as compared to people who were also given those vitamins, but additionally did red light therapy. And look at these results. There was a 2-point further lowering of TSH when people added the red light therapy on top of the supplements. And there was a nearly 400-point reduction above and beyond what you would see with the vitamins alone when using red light therapy for TPO antibodies. Red light therapy, I am now even more convinced, is something that you should consider if you have either Hashimoto's or if you have subclinical hypothyroidism. We will be doing a follow-up podcast with more details on red light therapy devices and protocols, but essentially In this study, they used it for 3 to 4 weeks, the red light, 2 times per week, a duration of 160 seconds per treatment, and regarding distance, they had the laser or the light in contact with the skin. So in summary, when you have sluggish or subclinical hypothyroid, when in doubt, monitor. Retest your TSH every 3 to 6 months. Be careful not to too quickly go onto hormone because, as we've discussed, there is a growing concern that people are being given hormone with, I think, good intentions. But now that we have adequate scientific research looking at this, we're realizing it doesn't help people. In fact, I would argue it harms people because oftentimes that hormone is then on, people are using it lifelong. Be careful of overzealous prescribers and get a second opinion if you're not sure. I can say that in the clinic, we will see 1 or 2 cases of this per week. And if you think about it, if 37.2% of people are on medication that they don't need, and we're working in a specialty clinic with a population of people who are operating in a more progressive fashion, seeing doctors who are more sort of willing to entertain compassionate use of thyroid hormone, this might be why it feels, at least to us in the clinic, like maybe 1 in 2 of the people we screen don't appear to need their thyroid hormone. If you do have sluggish thyroid, use these natural tools of vitamin D, selenium, myoinositol, and red light therapy to help increase the likelihood that you will revert back to normal. So, in any case, really interesting research. The paradigm here is clearly shifting away from one that years ago used to recommend that when in doubt, give thyroid hormone because it'll probably help. And again, given that JAMA meta-analysis, we're seeing that no, actually, the thyroid hormone doesn't seem to help people. Most people will actually normalize with time, and thankfully, there are natural things that can be done to help increase the likelihood that you'll have a normalization of your TSH and not need lifelong thyroid hormone medication. Okay, well, hopefully this has been interesting. Please comment and let me know what you think, and also subscribe so that you'll see future videos on topics like this from us.